Before beginning with the Bob interactive method, I show my patient his previous Bob score. I also show past scores and his previous mouth map to give a reminder on what aids were recommended and what sites were inflamed. We also check together what comments were made previously. I then start a new Bob score. Starting on the upper right sextant, I begin to complete an intraoral examination. This is to check if there are any additions or changes with regards to missing teeth, crowns or implants. As Edward has had previous Bob scores completed in the past, his data is saved and only changes need to be input. Moving from sextant to sextant, I can see that no changes have been made, so I simply swipe along until I start the Bob score. As I have completed a Bob score on Edward before, I can view the colour of the previous interdental brush by the colour of the circle adjacent to each interdental space on the chart. My patient is also able to view his assessment by the mirror above him. This is part of the Bob interactive method. I begin with the red prime interdental brush and check if the brush is still appropriate. I notice that it is now possible to increase the brush size. I explain this to Edward whilst demonstrating and reminding him of the technique in this area. Edward then inputs into his Bob score the pink prime interdental brush and also bleeding that was present. In the upper right sextant, I recommend a single tufted brush, as Edward has a large interdental space here. I demonstrate and remind Edward how to use this aid in that area. He then clicks the Others button to input this aid. I then use the red prime brush, which is what I had recommended on the last appointment. However, today we can increase to the pink prime. Edward again watches the technique I demonstrate with the attached mirror above him. Interacting with the tablet, he simply inputs the colours of the brushes into his Bob score. The Bob interactive method is perfect for regular and review patients like Edward, as you can complete the Bob assessment with the IDB only method, and it allows the clinician to complete oral hygiene simultaneously. Here you can see that Edward is really taking note of the technique I am demonstrating. This upper anterior sextant requires only one size of interdental brush, so he simply holds down onto that colour button, which then infills the whole sextant with that one colour. A notification also reminds me that I have now input 3 or more aids, and this questions if my patient is confident and competent to use this many. Moving on to the upper left sextant, I notice that Edward now needs to use the red Perio 405 brush. I demonstrate this to him, and once again he inputs into his score his new brush colour. Edward is in complete control of his score and health with the Bob interactive method. He is fully engaged and involved. This will in turn strengthen his motivation and behaviour towards using interdental aids daily. He can see clearly previous inflammation and sites that were inflamed today on his Bob score. I remind Edward to look into the mirror when I am using the interdental brush so that he can be reminded of the technique recommended. We finish on the last sextant, that being the lower right. Once completed, it's then time for the reviewing coach, in which I will sit the patient upright for. The review and coach begins by clicking the mouth sextants in the top right corner of the screen, which will bring up the patient's full mouth map for my review. I can then share this view with the patient. By clicking the button on the lower left corner of the screen, I can place the mouth map into the patient view. The patient now has a mirror image of his mouth. He too can have an overall review of the interdental aids recommended and also what areas have shown signs of inflammation. I begin the dental coaching with my patient by suggesting we begin with the smallest interdental brush and in an area that will feel easy for the patient when starting. In Edward's case, I have suggested the turquoise prime interdental brush to be used on the upper anterior teeth. The reason why this routine is suggested is to help build upon the feeling of ease and success when using the interdental brush. This also gives the patient confidence when it comes to using the interdental brush later on at home. Edward is always using the attached mirror to view his technique. The upper right sextant has a large interdental space, so I demonstrate the use of a single tufted brush to Edward, who then demonstrates back. I assist Edward when completing the coaching. I use touch to teach methods to ensure he is learning an atraumatic yet effective technique when using the aids. My patient has one area in which I have recommended the red Perio 405 brush. I begin by demonstrating to Edward the technique, as this is a new addition to his routine and he has not used this brush before. However, as he is now more confident and competent in using interdental brushes, I am happy to recommend one extra colour for one extra area. Any areas in which today I have changed the brush size, I make sure the patient can demonstrate back to me the technique with this new size. Such as this pink prime brush in the lower left region. The patient had been using a red prime brush in this area, however, today it was clear that we could increase to the pink. So I assist again with Touch to Teach methods. I now discuss with Edward the quantity of dental aids I have recommended and ask for his feedback in how he feels about the addition of brushes. Edward is feeling very motivated and is happy with the addition. I remove Edward's mouth map and ask him to now click the finish button so that he takes ownership of his own health. Once the finish button has been clicked, the Bob score is completed and Edward receives his overall Bob score, in which I can discuss and explain further. Edward is extremely happy with the improvement in his score today, as it is lower than his last Bob score. However, he does understand he still has some room for improvement. By viewing his previous scores, Edward is feeling more motivated as he has moved from the severe inflammation category to that of the mild. His mouth map is also viewable to take a final review and remind him that this is the image he can use at home to support him in using his interdental aids. I then make a note in the comment section to give him a reminder when he gets home. The comment I make is that the grey circle on his mouth map indicates the use of the single tufted brush in that region. I then save, close this Bob session and send the patient his Bob score, which he will receive via email. It is now time to complete the patient's dental treatment, and in my case here, I will finish my Bob Interactive method with the dental hygiene cleaning.